I'm going to be admitting folks, but I was just going to say, let's hit that record button.
Exactly.
Awesome.
Thank you.
Do we have an AI bot in the room taking notes? Not that I believe in that sort of thing, but just asking for someone. Hey there, Sue Pickett.
Hi, V. You're asking for a friend.
Sue, I refuse to even let AI into my life because there's nothing artificial about my intelligence.
I'm with you, my friend. I'm with you.
No shade on anyone that's doing it.
Well, as a
Welcome,
struggling grant writer, I love them.
Yeah, Lee, I've cheated and used one on a press release, but it just didn't sound like me. I don't know how to make anything sound like me.
No, you want nuance if you're going to do that.
I think that personality is really important. Come on in, Gail. Good to see you. Singrid, Michelle, thank you. Please put your information in the chat box.
Hello, everybody.
Hello.
Good to see you, Gail.
Hi, everyone. This is Michelle.
Hi, Michelle. Thanks for joining us. We're right at 12:59, so we'll get started in about 2 minutes. If you're just getting in here, please put your information in the chat box, and we're going to get started soon.
All right, Randy, I made you co-host so you can be ready for your presentation.
All right, thank you. Hello.
It's good seeing everybody's face.
Okay, so the warm weather has activated some little bug that is, of course, flying right on my nose. So that's what this is about.
Well, Courtney, haven't seen Courtney in ages.
Hi, Lee. How are you?
Nice to
It's so
see
good
you.
to see you. No, I saw you at the Cook County Mental Health Summit, but I saw you and it was such a big room.
Oh.
And you were talking to someone, but I've been meaning to connect with you.
Yeah. Well, meet Fanya Burford-Berry, the director.
Hello, how you doing, Courtney?
Nice. I'm doing well. How are you?
I'm doing well. Dr. Ruchi, I see you came into the room. You are a co-host too, so you can share your slides as well for your presentation. We've got a jam-packed meeting today, y'all.
Thank you all for getting your information in the chat box. It's 1 o'clock on the dot, Fania and Lee, so we can get started whenever you two are ready. This meeting is recorded, everyone.
Y'all see those people who you see? I see nothing but just
We'll wait
please feel free to mute
couple more
yourself out.
minutes. We'll wait a couple more minutes so more people can come
Hey,
in.
John Warney.
Hey, Veronica, good to see, or V, good to see. I don't know why I called you Veronica. That was weird.
I was gonna say, I don't even think you say that.
I don't think I've ever once called you Veronica.
I'll accept that. Good to see you.
Good to see you, V.
Come on in, folks. We're gonna get started shortly. If you're just joining us, please get your information in the chat box.
This is like old home week.
Yes, it's been too long.
I know, right? We're at 45 folks and the room is constantly populating. Oops, 46. Ruchi has the credentials she needs.
Yes, I gave Ruchi credentials, yes.
Wonderful.
Okay.
Lou, thank you so much for joining us. Isabella, good to see you. Dr. Huggett, great to see you. We're right at 102, guys. I'll continue to admit people into the room.
That's where I be at, bro.
In a supervisory position to the point now where she is to supervise the training of the state.
So this was long, buddy.
Other training and the
This is the thing. Please mute everybody.
Because I didn't know. I heard the story.
Yeah.
Oh, man, appreciate it, man.
Your cameras, your video and audio out. We are getting ready to get started. While we're very nosy and don't mind knowing your business, I guess it's not the time. So please mute yourself out. We're going to get started. Client and lead, we are right at 103.
All right, welcome to the task force meeting, our general task force meeting for February.
I know you.
Who is talking?
Got a few folks that are not muted. Let me go through.
Let's get folks muted.
I'm just going to go through and mute people as I go. Don't take offense. It's not personal.
Appreciate it.
Don't take it personal. If you're not talking, it's not an attack. I'm just getting everybody muted so we can get started. All right. I think we are good to go.
All right, good. Welcome to the task force meeting. I am Burford-Berry. Welcome. So quick, because we have a packed agenda today. So anybody's here for the first time, unmute yourself and then tell us who you are, what role you have in your agency, as well as your agency, and then tell us what brings you to the meeting.
Hi, I can go. I'm Tiffany Tahata. I'm one of the Rush Addiction Medicine Fellows, and I'm here to present with Dr. Fitzgerald.
All right, welcome, Tiffany.
Welcome, Tiffany. Thanks for joining us.
Thank you.
Hi, I'm Randy Moberly, Senior Program Director with the Illinois Regional Care Coordination Agency at Advocates for Human Potential, and I'm here to present on the Illinois Regional Care Coordination and the things that we're doing.
Very good. Welcome, Randy.
Thank you.
And I am Chantel Pearl. I am a Deputy Director with the Illinois RCCA, here to present with Randy. Or as support, I'm not actually presenting. One of our regional advisors will be.
Well, welcome to the meeting.
Hi, I'm Caroline Roa, she, her pronouns. I am the Substance Use Program Manager at Chicago Public Schools at the Office of Student Health and Wellness. And I'm just here to get to know a little bit about what you all are presenting on.
Fabulous. Welcome to the meeting.
Thank you.
And my name is Clara. I'm a mental health therapist and a social worker, and I'm also just here to learn about the task force.
Welcome. Glad you're here.
Hello.
Hello.
Hi, my name is Malefi Adeyefa. I'm a clinician with Wolfpack Therapy. I work with Chelsea Valaverte Barnes, and my interest in being here, since I'm physically located in Oak Park, is to learn a little bit more about what the task force is doing and how or if we can partner and continue to affect change.
Well, welcome, Malefi. I love that name. What does it mean?
He who keeps traditions.
All right, very good. Who else is new to the room? Well, welcome. Make sure you put your name and your organization and your role in your organization in the chat so we can keep up with you all.
And your email address would be great.
And thank you, V. And your email address so that we can keep up with you all and send you out great announcements. So, like I said, we have a packed agenda, so I'm going to be moving through this really, really quickly. So our next piece will be a legislative update, but we'll have Isabella talk to us about Bring Chicago Home. So Isabella, unmute yourself and tell us about Bring Chicago Home.
Hello, everyone. Hi. Okay, so Bring Chicago Home is less than 30 days away from the election. It's going to be question 1 on the ballot for March 19th. For those who are unfamiliar with it, it is a proposal to increase the real estate transfer tax for properties sold that are over $1 million. It is a one-time tax. It is not an increase on property taxes. It will not impact anyone who doesn't own property or who owns property worth less than $1 million. It's a tiered increase as well. So it will actually, so let me rephrase that, excuse me. It's actually gonna decrease the real estate transfer tax slightly if you own a property and you sell it and your property's worth less than $1 million. Then it's a tiered increase for properties worth $1 million or more. So one-time tax, all of the revenue, if it's passed, all of the revenue from the tax will go to a dedicated revenue stream for housing for people experiencing homelessness. This is extraordinarily important for the work that we all do because it will address populations and demographics that are not currently having their needs met by our traditional homeless response system. So like permanent supportive housing is not meeting a lot of people's needs, or like people are not eligible for it based on where they sleep or the amount of time they've been homeless or things like that. So it's going to meet it's going to fill a lot of gaps, meet a lot of needs if it's passed. So our asks here are to go out and vote on the 19th of March, but we'll also send some follow-up asks around if you're interested in doing canvassing in your neighborhood, if you're interested in having a community meet and greet, or like a Bring Chicago Home meet and greet at your agency. We can have folks from the Chicago Coalition for the Homeless, from the Bring Chicago Home campaign, come to your agency. Come to your agency and like talk to your staff, your colleagues about what it is that Bring Chicago Home is, introduce the proposal, all of that. There's a ton of ways to plug in. There's a leadership circle that is predominantly executive leadership from different organizations that is doing like higher level fundraising and engaging with their staff and leadership from around the city. There's a lot of ways to plug in short. We will I'll have Fania send like some follow-up stuff around like canvassing and things like that. I see a question, what does the text go to? It's a great question. So it goes to a couple of things. After like a ton of negotiating about what it can and can't go to, we settled on permanent housing. So like subsidized housing, so not affordable, but actually subsidized, which means that people pay 30% of their income if they have income, or pay nothing if they don't have income. That could be in the form of site-based or scattered site housing. It can go towards only certain types of shelter, so either weather-based emergency shelter or non-congregate shelter. So it can't just be like just like adding more like crappy beds to the system. The third shelter provision is one-time capital expenses for shelter improvement. So it could not be used again to like just add more like inadequate congregate beds to the system, and it can't be used for like annual expenses for a shelter. It can be used, there's a small amount allotted for like homeless prevention services. The city was unwilling to budge around like a lot of actual percentages, but the oversight will be a committee that is like formed of predominantly people with lived experience of homelessness, and then people from like providers, and then people from required city departments like DFSS. So it'll be a lot of people with lived experience who are at like the leadership table, who are providing oversight on how the funds are spent. If it's passed, the vast majority of it going to housing and then supportive services to the people who are being housed. And it's like estimated to bring in about $100 million a year past. And there's similar models in, I want to say New York and California that are working. And then Tim linked like the main website, which gave you a lot more detail. After the meeting, Fania can send out more specific information about how you can plug in. So like if you're interested in canvassing, if you're interested in having someone come to your agency and talk about it, or come to your ward, or come to your block club, or anything like that, we're so happy to plug in. That's all I got, unless folks have questions. I see a lot in the chat. If any of them are for me, just let me know. Otherwise, just raise your hand. Otherwise, I'll shut up now.
Anybody have any questions real quick for Isabella? Thank you, Isabella, for this initiative. As we know, unhoused folks and substance use disorder go hand in hand, and so it's so important that we support those who are unhoused. So thank you. It's rich. All right, so let's go on next. We have Sue from Advocates for Human Potential to talk about our harm reduction surveys.
Thank you, Tanya. Hi, everybody. Good to be with everyone this afternoon. So one of the great things that I get to do is work with Lee and Fanya and Lou around what has been our overdose prevention site community engagement project. And we've talked a lot about different results over the past 4 years of our activities that we have done for that project to educate people on the West Side about overdose prevention sites, about OPS, but also about harm reduction. And our focus this year, while we're waiting for OPSs to become a reality here, we know it's going to happen one day, but in the meantime, we want to be educating people about harm reduction. And to help do that, we need to know what people think about harm reduction and what they do and do not know about harm reduction, so we can get the right education to the right people. So after this meeting, later today, I'm going to be sending Fanya a link to send out to everybody on the task force to our online harm reduction survey. It takes about 10 minutes to fill out. It's real short. It's going to ask you what you think about harm reduction, what you know, what you think about it on the West Side. We'll be using all of those results as part of our work to help think about who on the West Side needs to know what about harm reduction and what beliefs do we need to correct. So please, please, please take a minute. Fill out the harm reduction survey when you get that email with the link, and feel free to forward that email to people that you know and work with and whatever, your neighbors, your friends, everybody on the West Side. We want to try to get as many people on the West Side, at least 100 people, close to 200 or 300 people to fill out the survey. So we really know what's needed on the West Side to get more harm reduction. And that's it. All my information is in the chat, so please feel free to reach out, and there'll be more information later this afternoon. Thanks, everybody. And I have to jump to another meeting. I'm so sorry.
Thank you, Sue. All right. Does anybody have any questions? All right,
I am not seeing any questions in the chat box. It's people who are saying good afternoon and sharing their information. So thanks, everyone.
Yes. All right.
Oh, wait, I just found one. Carly says, what does the higher tax go towards exactly?
Isabella answered that question. So,
Oh, got it. That was the only
hopefully,
one.
Carly, we got that for you well. So the next one is Dr. Ruchi approached us a couple weeks ago regarding overdoses that she was seeing at PCC Wellness Clinic. And so she is going to do a presentation regarding youth and opioids and give us some of the information to help us guide our conversation and to see what we as the West Side Heroin Opioid Task Force member associations can do with this issue. So Dr. Ruchi, take it from here.
Hey, everybody. Hope you're having a great Wednesday. I'm Ruchi Fitzgerald, and some of you know me, some of you don't, but it's wonderful to be here with all of you. This is an important topic, and we've seen an increase in adolescents who are seeking services at our outpatient and inpatient site. I want to reintroduce Dr. Tiffany Tejada, and also just introduce Dr. Dan Ignell. He's been on this meeting before as well. Dr. Tejada is a Rush Addiction Medicine Fellow. She spends a significant amount of her clinical practice at our site at PCC in West Suburban. Dr. Ignell is the medical director of the West Suburban Medical Stabilization Unit, or Withdrawal Management Unit. Dr. Tejada is going to start us off, and then I'll pick up for the rest of the presentation. Go ahead, Dr. Tejada.
Okay, thanks for the introduction. And yeah, so thanks again for having me. And so today we wanted to draw attention to the overdose crisis amongst adolescents in the US. And as Dr. Fitzgerald mentioned, there's been an increase in these overdose deaths over recent years. In 2022, there was an average of 22 adolescents who died every week of drug overdoses. And now drug overdoses represents the third leading cause of deaths in the pediatric population, which is pretty alarming. And between 2019 and 2020, the rates of overdose more than doubled, despite drug use amongst adolescents being overall.
Okay, go here again.
And this is partly because of the availability that contain fentanyl. Fentanyl has been implicated. Oh, sorry, I think there's some background noise. And fentanyl has been implicated in at least 75% of these overdose deaths. And what's also alarming is that a lot of these adolescents who do overdose don't have a known history of opioid use. They overdose while experimenting. Next slide, please. Thank you. So on the right here is some data from the Kaiser Family Foundation as well as the CDC. And it is documenting the drug overdose rates amongst African American and Hispanic adolescents from between 2018 to 2022. And although white adolescents do account for the majority of these drug overdose deaths, there's been a very large increase in these deaths amongst African American and Hispanic adolescents over the last few years. And since the start of the pandemic, those overdose rates have actually increased more than fourfold. And by 2022, the rates of overdose deaths amongst Black and Hispanic adolescents actually surpassed that of Caucasian adolescents. Next slide, please. And this slide is just showing some data from the Illinois Department of Public Health regarding monthly opioid fatalities within Illinois from between 2020 and 2022. And as you can see, the rate of overdose death rates has been increasing. And this includes the youth. So for those ages 13 to 17, there were 3 opioid-related fatalities in 2020, and that increased to 14 in 2021. So just in the span of a year, this rate has increased exponentially, which is pretty alarming. And yeah, thank you, Dr. Fitzgerald. I'm going to have to hop into another meeting, but I'm going to turn this over to Dr. Fitzgerald. Thank you.
Thanks so much. So while you might think that those numbers are small, they're not insignificant, considering that drug overdoses and poisonings are now the third leading cause. And if we look at drug deaths that are, deaths that are labeled as violence, we look at our local community, this is becoming a very significant issue right here in our local community, something we are starting to see at alarming rates. I am not going to go through all of these individual patients. This is like de-identified information that I've changed details on. And I just want to clarify, so these are not actual Percocets. So this is what adolescents think that they are purchasing. We've sent them out for testing through a program called DEA toxicology, which is formal testing. This is illicitly manufactured fentanyl, also known as IMF. There are other substances that are contained in these samples. They are adulterated and they cause overdose in these individuals for a number of reasons. The primary reason is that adolescents do not have tolerance. They don't have opioid tolerance. They are young individuals, so they're often resilient. They may not have a fatal overdose. However, many of them have had fatal overdoses. And those are the ones that have those fatalities, but some of them do survive. They are difficult to treat by just a general pediatrician with no addiction medicine training. And many of them might not require medication for opioid use disorder treatment. So it really needs a specialized individual to assess for that. But if one begins to use these counterfeit pills on a regular basis, they may develop tolerance and subsequently a substance use disorder, just like an adult would. And those are some of the patients that we have seen voluntarily seeking help at our clinic and hospital. So that's kind of what I'm here to share with this audience. And it also extends to individuals who are seeking, some type of comfort from trauma or grief with like purchase of illicit Xanax or possibly, you know, a quote unquote pick me up with, you know, Adderall that's counterfeit. So that's what we're seeing in our community. Technically, the adolescent population does extend above the age of 20. And so we have seen, and this is a more challenging population to treat because they're not in school. They may or may not be living with family, and they tend to be lost to follow-up if they don't have a really strong outreach team. And that's connecting with medical or behavioral health. They're also then at risk for starting with like more substance use, which extends to like intranasal use, smoked use, and intravenous use. And that's actually what we have seen in a very significant amount is like when we see those patients coming in and they're saying, I'm using IV or I'm using intranasal daily, this amount. And we ask them, when did you start? And they say, I started when I was 15, 16. Now I no longer live with family. I'm unhoused. And that's what I'm just highlighting for you here. And they've had multiple overdoses, like numerous and multiple. We really focus on a harm reduction approach and also a medication forward approach, simply just to save lives. And we've unfortunately lost patients to fatal overdose from these situations. This is an important graph. And like I said, it may not seem like a huge number. We had a huge uptick in November, and we're seeing another uptick here in late January that may extend into February. These patients take extraordinary number of hours to care for due to case management and social work services that are often non-reimbursable by their insurance. They also may not have insurance. So it creates a lot of challenges for outpatient programs. However, you know, it's definitely worth the effort. I'm going to leave you with this and then open it up for discussion, since we do have time reserved for at least 10 minutes of discussion. There's a need for urgent action in our community and at the state level. So basic things, if you're a service provider, you can start talking to families and adolescents about these counterfeit pills. They're not real. I've yet to see one that was actually real. I've seen one that was actually had no fentanyl in it. That was an interesting case. Had nothing in it, just binder. And also then there's such an important need for naloxone distribution, naloxone saturation in this population. Stigma is a big barrier for getting this out in our community. And programming at schools, I know there's a huge effort to get this done, and that's wonderful. Social media platforms, and this is all really based off a recent article published in the New England Journal of Medicine that really outlines some key recommendations. And then really what I'm here to also mention is that, you know, and PCC is absolutely willing to step up and do this, is that widely available low barrier mental health and integrated addiction treatment that's evidence-based. Buprenorphine is drastically underutilized in this population. Only 1 in 4 residential treatment programs for adolescents even offer buprenorphine treatment in our nation. And we have very limited residential programs that are available for adolescents in our state. In addition, there are very few outpatient programs dedicated to adolescents. Sadly, there are many rules. You know, we don't see patients under 18. Pediatricians generally aren't trained in this. And as a result, you know, adolescents really miss out from safely and confidentially seeking services. So I'll leave you with this. You know, medications for adolescents are evidence-based. They can save lives. They should be integrated into a comprehensive program that includes, you know, their whole health, family counseling, harm reduction, and peer support. I cannot emphasize how important it is to have peer support for this population and to integrate these adolescents into a cohort that's age appropriate. Harm reduction is so important for those adolescents who are actively using. That extends beyond naloxone, education on fentanyl and what's in the drug supply, and when appropriate, fentanyl test strips and access to safe use supplies for those who are actively using or at risk for active use. And then lastly, I want to mention that it must integrate other preventive measures: HIV prevention, STI testing and treatment, reproductive health care, hepatitis C testing and treatment are other extremely important components of SUD treatment. Here's my contact information. Please save it for referrals. That's our number. You can email me, but please do not email me personal information about a patient. Please use that phone number instead. I'm going to leave that up on the screen for just a minute and open it up for discussion.
Thank you, Dr. Ruchi, for bringing such an important subject to us. Anybody have any questions for Dr. Ruchi and the team at PCC Wellness? I thought I saw one from John in the chat. John, you want to unmute yourself and ask your question?
I'm looking for it, Fanya, but I think I lost it. Hold on.
There's a lot of folks.
I definitely saw it, but these are going fast. Thanks for your interaction today, everybody.
Yes.
If you had a question, I guess you can raise your hand or unmute.
I see Chelsea was up first. So Chelsea, you want to ask your question?
And I think Sheila had one.
Well, everybody just raise your hand so we can get you out. Yeah, we go.
Like school class.
Yeah.
Don't talk over each other.
Yeah.
Thank you.
I see Ann too. All right. Okay. All right, Chelsea, go ahead on.
Hi, Ruchi, as always, wonderful presentation, and thank you for your work. I'm an adolescent therapist, and this is a particular concern to me, and just didn't know if everybody here knew about Louis' Law that passed last year that would effectively sort of try to tackle in a step-up strategy. One of these points of recommendation that you provided here, which is to basically mandated that the state provide comprehensive drug education guidelines for all schools, regardless of if they're public or private or online. It doesn't mandate that schools use these guidelines, but it is a very harm reduction focused sort of educational opportunity that's age appropriate and trauma informed. So the state is supposed to be done with these recommendations by June 2024 in lieu of the 2025 school year. I'm still unclear as to where they are, but you best believe that I have been checking in as I was, a part of helping pass this bill, but we have to keep doing more. And I just wanted to thank Ruchi again, your team, for all your work.
Thank you, Chelsea. Drop in the chat Louis' Law, okay? So we can all have reference to that. I appreciate that. All right, Carlos.
Yeah, thanks. Yeah, I'm so glad this is on the agenda right now. I think, Dr. Ruchi did a really good job of convening a meeting last Friday. I believe it was a Friday. And, the whole piece is, how do we get to a point where we actually are able to have adolescent services that are appropriate, right? I mean, so often we have adult models being injected on, thinking that this is going to do better. And so the discussion's going on now, and I think it's high time that we use our collective energies to try to get funding that way and appropriate training too. A lot of the time, I know when I've been doing this work for a while, it's a stepping stone to go somewhere else, and the youth can smell us out right away if we're disingenuous. So I'm just glad this is on the agenda. Thanks for making this happen, Dr. Ruchi.
Carlos, quick question. What are you seeing in the schools?
It's interesting. It's really just adolescents that are starving for appropriate and genuine adult relationships, right? I mean, our program is demonstrated with just 1 hour a week, and then the youth having access to us after hours if they have anything going on, that they actually are able to not only reduce their drug use, but they end up participating more in school. They have a sense of being, a sense of belonging. Yeah. But it takes work. I mean, it's got to be people that understand what they're doing. You never come in telling a kid what they're going to do or that drugs are bad. The harm reduction approach is absolutely critical, right? Where you give them the ability to talk freely and honestly about their drug use and what they like about drug use.
Thank you, Carlos, for the work you do in schools. John.
Thank you. And I apologize for jumping in the combo earlier without raising my hand. But I put a question in the chat about just how does the study do or define adolescents? Are they minors, or is it a broader definition of like youth? I know that Dr. Sorrell put in like Sam's definition of 12 to 25. The reason why I'm asking that question is because, and as we all know, like minors are so difficult. It's a unique population, and usually when we're talking about doing outreach and engaging minors, we also have to talk about engaging their guardian or parent, and having them approve whatever we're doing, which is, you know, especially in doing harm reduction education. I mean, we have to train the parent, and then we have to, like, on harm reduction or harm reduction resources, and then we have to engage the youth. So it's just like a double barrier, in my opinion. So that was the first thing I wanted to ask.
Sure, that's a great question, and certainly one that I've encountered. So I just want to be very clear. Adolescents can seek, like minors, can seek substance use disorder treatment confidentially. However, any health center or program will have their own policies about when an emergency contact or guardian will need to be involved for a number of reasons. So I'm just going to leave it at that. And I think that's really, really appropriate, right? But they can receive like medications, counseling, et cetera, harm reduction. And we have had, and the reason that the ages in this presentation were like, we started with age 15 is really just because that's the age we actually adopted some policies due to the increase, to like be able to, we are not a children's hospital. We have a newborn nursery and like some NICU services, but we don't admit peds at our hospital. We made an exception to get 15-year-olds admitted for medical stabilization. Thanks to Dr. Ricknells. We're family doctors. We can care for all of them, but we can't admit like an 8-year-old with asthma exacerbation at our hospital. Like that is something we don't do. We made an exception to step up to do this. You'll be hard pressed to like get other hospitals to do such things, and create such kind of like adaptable needs for programming. And then if you want to break down the data further, I can just email you directly for drug overdose deaths, but there has been a significant number of drug overdose deaths from a one-time use of a counterfeit pill in the minors population, and that's very publicly aware.
And I'm gonna take the opportunity to just ask a follow-up question about the pills. How did was this self? How did they, was access to the pills, was that information given up freely from the adolescents? How was that determined, that they were accessing either the street market, or was it pills that they got from, let's say, like their parents? Like, how is it, was that any of that determined in the information? I'm not sure if I'm asking that question right, so please let me know.
Yeah, I'm happy to answer that. So social media platforms, including things like Snapchat, make the pills pretty widely available. In addition, law enforcement has been involved in many of these cases. So that's where formal investigations were done to find out where the pills were obtained from. They're not coming necessarily from family members. And then I can't share any more information, unfortunately, in this group about where the pills are coming from from our community. So I'll just
no, but it was identified that it was the illicit market. That's what I was trying to.
Absolutely.
Gotcha. All right, thank you.
Thank you for that question. That was really good. Lee.
Just wanted, there was a very involved mother and community member named Aisha Oliver that was on our meeting on Friday, and she's going to have an event on the 29th called Dying for Attention, and I'm going to put the flyer in here. That's all I wanted to say. But I want to thank Dr. Fitzgerald and Tony Strong and everybody that came. We had people from Youth Outreach Services and Build, and Carlos was there. Al Orsello from the Prevention Partnership, the peer leadership training, the trainings they do. So we do have some eyes on this and people working on this, and I think there's a great opportunity for some real collaborative work on this issue. Thank you.
Those who want to be involved, email Dr. Ruchi and let's see what we can do with this issue. I do want to caution us to be careful about criminalization of young people with this issue. So we we need to approach harm from those who sell and from those who consume, right? And harm reduction is on both sides of the issue. So Anne, I want to have you speak, ask your question.
Well, thank you. It's actually more of a comment. I was invited to go to a high school a few months ago and just do a Narcan demonstration for parents. And so none of the parents showed up. And so then it was, could I talk to the teachers? And it felt like a very indifferent administration. But, you know, I'm so riveting that people got involved in, but we had a big discussion, but it really came down to that the people were not allowed to carry Narcan. They're not allowed to have Narcan on them. And this particular school had 3 students who overdosed on fentanyl that was in gummies. And so, you know, just kind of trying to encourage people like, well, how do you organize and think about like approaching, you know, the school board about this, because this is a real thing. And they finally, I mean, in this meeting I was at, designated the person who arranged for me to be there, who was an outside consultant to carry a Narcan for the entire high school, which she's not even there every day. So, you know, looking at the law, I'm like, this is great, but I think a lot more education needs to happen, like just school to school. I mean, we see this a lot, like people, oh, you do that? And like, yeah, I've been doing this for years. And people aren't aware of that. So I think it really more kind of the West Side Opioid Task Force kind of, you know, hitting the streets kind of level of going school to school and talking to the administrators and seeing where the school board stands on this.
Thank you, Anne, for that comment. Sheila.
Oh, okay. So I just had a question about the slide and the spike in November. If Dr. Ruchi, you have any thoughts about what caused that and what might be fueling the increase you're seeing now?
I can't share more of that information, I'm sorry. But I do anticipate we'll see more people. But there are hotspots and yeah, that's why we're having this conversation. So yeah.
Just curiosity, is it due to the holidays coming up or is that something else? Okay, thank you. All right. Courtney, please.
Hi, my name is Courtney Olive. I'm a substance use intervention specialist with Chicago Public Schools. I do see, you know, a few of my colleagues are on this call today as well, Caroline and Lindsay. So I'm really happy to be here. Thank you so much. I just want to update everybody. So back in the fall, CPS acquired some funding through SAMHSA to be able to really start to show up for students in schools like never before. I too will take the time to acknowledge that historically we really haven't provided much support to students who are experimenting with substance use. But we are rolling out Narcan into all schools in partnership with IDPH. The Office of Student Health and Wellness has actually already mailed Narcan to every high school in our district within the past 2 weeks. So that comes with a lot of really exciting changes to our policies to be able to provide training opportunities. We actually have Dr. Sorrell with Rush, who's providing those trainings for our CPS faculty to be able to administer Narcan in the school setting. So this is something, I held a training yesterday. Schools are already receiving this Narcan, and this is so exciting. So I was really excited to be here today, to hear the presentation, to hear that we're having conversations around adolescent substance use. And we have a lot of new training opportunities that are launching, all about harm reduction, all about how we can see substance use from a health-centered perspective instead of that discipline perspective, which is how we historically address substance use behaviors. So this is a very exciting time. I know we are late to this, but I'm willing to acknowledge that, and we are absolutely hiring more people. We are stepping up to be able to meet students where they are at using these evidence-based best practices. Just an update for everybody.
Thank you, Courtney. Yes.
Courtney, just a quick question. When a student's identified, that they might have used a substance or have a substance use, where do you refer to? And is it a non-disciplinary track?
Yes, that's a great question. So these are things and policies that we are actively building out. It is a non-disciplinary track. It confuses people sometimes because I'm actually in my role in a discipline department, but I'm there to create a shift and to stir things up. So right now what we are doing is trying to build out strategic partnerships with local treatment facilities, making sure that we can connect our students who are eager to get substance use supports that are willing to do that. So we are kind of in the process of building out these strategic partnerships so we know exactly where to send our students. We know that insurance is not a barrier, and we're looking to build these partnerships in the communities. One thing I've noticed is a lot of these, inpatient or residential substance use treatment facilities that accept Medicaid tend to be pretty far. So this has been a barrier that we've noted, but we are kind of in those initial phases of building out these strategic partnerships, making sure that, again, we are addressing the health needs. We're not addressing substance use as a discipline issue. And we are doing everything we can to really show up for these students and to hopefully have warm handoff when students need to be connected to treatment resources.
Thank you. Thank you for that approach. If please get in contact with Courtney if you can help with these services so that we can have services within our community and not outside of our community. So we need to move on. Thank you for the robust conversation, and also look at the chat. There's some really good stuff happening in that chat. So download that information that's happening in the chat. So next we have Advocates for Human Potential. They're going to be doing a presentation regarding the opioid settlement. All right.
I think the screen is showing. All right. Thank you, Panya, for having us. So good afternoon. I'm Randy Moberly, Advocates for Human Potential Senior Program Director for the Illinois Regional Care Coordination Agency. And I'm joined today by my colleague, Chantel LaPerle, who's the Deputy Director for the RCCA, and Derek O'Neill, who's one of the regional advisors for the RCCA, or the Regional Care Coordination Agency. I like to spell out the acronyms. We have so many of them. So we're thankful to have a few minutes today to share with you about the work of the Regional Care Coordination Agency, including the Illinois Opioid Settlement Initiative website, as well as the work that we're doing to develop 7 regional coalitions that are based on Illinois public health regions. So in April of 2023, the Illinois Department of Human Services Division of Substance Use Prevention and Recovery awarded Advocates for Human Potential to serve as the Regional Care Coordination Agency. So the RCCA mainly supports the Office of the Opioid Settlement Administration, or the OOSA, and has 3 main objectives or activities: administration of subawards and development and management of the Opioid Settlement Fund's website that I'll show in a moment, and then, like I said, coordination of 7 regional coalitions, and that's what Derek and Chantel will talk about. The RCCA consists of a diverse team of service professionals with deep knowledge of prevention, treatment, recovery, and harm reduction practices, and a lot of that is in Illinois. So we're currently providing program support that includes administration of subawards with organizations providing prevention, intervention, treatment, and harm reduction services for people experiencing substance use disorders. And we do that in accordance with the state-approved abatement strategies. We're also responsible for developing and maintaining systems and protocols to ensure that the subrecipients, their requests align with the intent of the funding and that the funded organizations comply with all of the appropriate procurement processes. So in addition, we develop and maintain systems, training and technical assistance and protocols for the subrecipients, the awards, to ensure that the funded organizations comply with the program or strategy evidence-based requirements. So whether that's evidence-informed or evidence-based practices. And like I said, we're responsible for establishing the 7 regional coalitions. Just a little bit about the, that's what I just said, sorry, got ahead of myself. A little bit about the Illinois Opioid Settlement Funds Initiative website. This is a key resource for providers and the public because it provides information from the Illinois Department of Human Services, SUPR, on the disbursement of the settlement funds. It also is part of the process to bring transparency to the spending of the settlement funds. The website also includes information related to the state of Illinois Overdose Action Plan, or the SOAP, as well as the Illinois Opioid Allocation Agreement. On the website, and this is one thing I think that people are interested in looking at, you'll find information related to the notice of funding opportunities. I'll get to that, but also about how the lawsuits that have been settled, information about the amount expected to be received by the state of Illinois, how much grant funding has been awarded and to which organizations, and the specific abatement uses approved by the governor's Opioid Overdose Prevention and Recovery Steering Committee, as well as the amount of funding available. So some of those are still being updated on the website because some of that hasn't actually come into play, but that's what the website will be providing as we move forward. And as I said, this is also where you will find a link to the notice of funding opportunities and the accompanying online application. So on this slide, you see the Illinois Opioid Settlements Initiative website, and that individuals are able to click on the funding opportunities page, and you'll see any other available notice of funding opportunities. And then if you click further, you'll see the applications open now page, and an individual will be able to select the notice of funding opportunity that's available here. This is the example of the intramuscular naloxone distribution hub, or the IMNH application that's open, as well as any that have been closed. So you could see that just recently, the application for the Opioid Abatement Strategies Effectiveness Evaluator, which is basically about data collection on for part of the work that we'll be doing, that has closed. And I do want to say just one word, is that, you know, one thing is, as we've seek to improve accessibility in the notice of funding of opportunities and the applications, we've provided information listed in different ways that we hope will help applicants. So we've included steps and checklists to help applicants move through the application process. And some applicants may find this process is different to kind of previous NOFO application processes. And we've also broken down some of the questions. So applicants will hopefully find this process to be more concise and concrete. And then likewise, to help with just kind of improving access and people's ability to use the system, we've included things like a budget workbook that's been included to help facilitate the creation of budgets. So we've added some assistance like that. We also have technical information sessions that happen approximately a week after the NOFOs are released. So people can join that, ask all sorts of questions. And then we have frequently asked questions that we will take questions. And then because of transparency, we want to make sure we maintain transparency, so people have access to all the questions that have been asked. We will post those on our frequently asked questions. So if you asked some questions recently, and usually in 2 days or so, but on Friday, we update those questions, and that's where people will see the responses to that. I'm going to pause just to see if there's anything in the chat before I move on. Okay, and now I'm going to turn it over to Derek O'Neill. Derek, I think, will come off mute and talk a little bit about the regional coalitions.
Hello, good afternoon to everyone. Seeing a lot of familiar faces that I've known over the years, and that's very welcoming. Well, I'm going to talk to you about the Illinois Regional Care Coordination Agency, which is a formulation of a coalition. And fundamentally, it's a group of members from the community, agencies, orgs, people from the community that we come together and assemble to address the opioid crisis. One of the things that will be done, we would discuss the challenges in the work from whatever position you work from. So if you're a community member or you work for an organization, whatever that looks like, you have some information and you have some challenges with the work that you've done. In addition to that, you have some wins. So to this point, what we've been able to do, we've been able to have a broad cross-section of people we've been able to bring to the table, from harm reduction organizations, youth prevention, medically managed care organizations. It's just a plethora of folks around the table. And the great part about that is it serves as an information exchange, because, you know, you have agency A on one side that may be doing harm reduction. They may have some good ideas for someone in youth prevention, kind of like this conversation has went to this point thus far. And once we get and collect that information, what we'll be doing is establishing a work plan. So the work plan will actually be what we'll be doing to be able to get to solve some of these concerns, issues, or problems we have. And I think this presents a great opportunity for us, not only as a community, but a state. So Region 7, which is Cook County, the state identifies as Bellwood, but it's Cook County, Chicago, and suburbs. So Region 7, I am the advisor for that region. And whoever is at the table, I will be the one that will be helping you through the different processes, helping to collectively establish the work plans and everything associated with the coalition. And the great part about it is once we get this information, we'll be gathering information, we'll be gathering available data, and we'll take that available data. Then we'll have everything packaged and we'll present it to the state. And the state will be able to make decisions on, okay, hey, this is what we're hearing from Region 7. These are the challenges they have based on these organizations, based on the community. This is what they're saying. So it's a great opportunity for us to put together something that will actually help maybe dampen the opioid crisis. Hopefully the goal is to have 0 opioid deaths in Cook County. That's the goal, you know. So we have some work to do and we can do it. The coalition meets quarterly. The first coalition meeting for Region 7 is March 14th. So if you're interested in participating and learning more about the Illinois Regional Care Coordination Agency Coalition, my email address is in the chat. Feel free to reach out.
Thank you, Derek. I'll just turn it over. Thank you so much, Derek. And Chantel, anything you want to add?
I think Derek covered it nicely. And again, if anybody is interested in joining our coalition, our table is big and wide and we have space. So feel free to ping Derek. You can also ping me if you'd like. I'll put my name in the chat as well. So thank you guys. Thank you for making time for us today.
Thank you for that presentation. I see Lee has his hand up.
Yeah, this is just kind of a Zoom thing. I think sometimes if people have put in their information early on in a meeting and people come in later, they're not able to see it. So if you could just kind of post your contact information. We'll try to get this out through the chat, but I also think if people need it now, they can get it. That'd be great.
Thank you, Lee, for that.
Thanks for that, Lee.
Anybody have questions for our presenters?
It looks like there's a few things in the chat box, Fanya and Lee. Something from, looks like Taylor. She says, she just said she had to hop off. Looks like Vanessa from West Side was asking about Narcan training in a Western suburban school district. She was wondering about an experience. Vanessa, did you want to hop on and speak for yourself? Doesn't look like a question, looks like a statement.
Yeah, I was just
Hi,
I was just
Vanessa.
hi. I was just sharing in the chat that the West Side Ross Council was asked to do some Narcan training in a western suburb school district, and it was a very wonderful experience. It was administration, principals, counselors, nurses, social workers, and I know they're in the middle of developing their what their program is going to look like and how they're going to roll things out, but just to be able to do those initial trainings with them and supporting them, initially was just, it was a wonderful experience. And I just wanted to share that out. And it's so glad to hear the conversation earlier.
Thank you, Vanessa. Anybody have any questions, comments?
Well, thanks for this opportunity, Tanya, and to the whole task force. We appreciate it.
Thank you, Randy. Thank you for sharing. Yes. If you have any questions, Randy is so accessible. So please do not hesitate to reach out to her and ask any questions, as well as Derek. So far, my interactions with those two have been great. So don't be afraid. All right. We are on time. Amen. All right. So the next person that has some exciting news to present to us is Jennifer Brothers from Cook County Health. Jennifer, if you can unmute and tell us some good news.
You're so funny, Fanya. Oh, yeah. Hi, I'm with Sophia, so we're trying to get closer so we're not blurry. Hello, everyone. I just want to first off by saying thank you to everyone who showed up last week for our inaugural Behavioral Health Summit. I'm so grateful for each and every one of you. I also want to do a special call out to Fanya and Carlos, our facilitators with the mostest. Thank you so much for lifting up this summit. We're really excited to see the next steps and kind of really developing a county-wide strategic plan that meets the needs of all of our residents. And so we cannot do that alone. That is only going to be done in partnership. And so I'm so grateful for that. And so with that, we can't give a whole lot of details right now, but Fanya, we did make an announcement during the summit that March 6th, we will be launching an open, and I see Tanya, Dr. Sorrell, thank you, who's also there. But March 6th, we are going to be launching a countywide open call from the Impact Fund. It's going to be $44 million into the community. I can't give details about that now, but what I can say is that we really want organizations, small and large, to apply. And we are really committed in the Office of Behavioral Health to having equity-driven grant making. And so what does that mean? That means that we're streamlining the grant making process, that application, so that we don't need certain things like economic disclosure statements and things like that. That if awarded, we can work with you on that. But in the meantime, let's stick to like the core proposal and the work that you are doing. During the open call process, we will also be doing capacity building workshops that will be live and people can ask questions, but they'll also be recorded for those that it doesn't necessarily work out with, so that everybody has try to level set the opportunity for developing a successful proposal. So that means we'll be doing capacity building workshops on program design, monitoring and evaluation, legal agreements. And so hopefully it not only helps with providing successful applications for us, but also in future applications for other funders. And then after the grant making process has ended and we have done awards, really providing technical assistance to our organizations that we are partnering with. And instead of doing the traditional reimbursement model, we'll be providing advancement opportunities, because we know that some of our smaller grassroots organizations have their barriers with financial supports in place. So we really encourage everybody, again, more to come March 6th. We'll have a website and all that greatness. But Fanya wanted us to come here today to we can't say anything more. Our lips are sealed. But just stay tuned because we're really excited about this initiative. Yeah.
Mark your calendars. $44 million is coming out.
March 6th.
Yes. March
Thanks.
6th. And once again, our organizations, you guys do a fabulous job. I want you to really think about collaboration, working together. It's start now. Start building the relationships now. If you already have relationships, dive in deeper, right? And let's have an imagination. Also, too, there's some surveys from Cook County. They're asking good questions to me because they really want to know what's going on. And please fill out those surveys, give it to your people who participate in your programs so that they can have a better understanding of what is needed for our people who use drugs and our people who are in treatment and recovery, as well as those who have as well as those who have behavioral health issues. With that being said, does anybody have any questions for Jennifer Brothers and Sophia? Yes. I see something in the chat. Can you please share that information? We will send out this video as well as all the presentations to everybody who is on our constant contact list. So
and then Fania, if it's okay with you, we can send out the community needs assessment survey to you to send out, as well as the workforce, because we're doing two different things.
Oh, I love it.
So
Yes.
thank you.
We will send that out. Yes.
Got it. Thank you.
Anybody, any questions, comments? Lovely. We're moving right along. So communication. Communication is the key to collaboration, to connection. And we as the Westside Heroin Opioid Task Force, all our member organizations, we need to communicate better. So Lee, V, as well as Anusha and I, we need to make sure we're talking to you all. So we are talking. So Lee, if you want to take this about how to communicate better, and as well as communicate to the broad public about what people who use drugs need, right? So Lee, take it away.
Well, I think the main focus is really, we've been approached by the Sun Times and others to let everybody know that if you have op-eds or articles that you'd like to get really stressing some concerns or some of your programs, please get them to us so we can get them to them. And we have over the last year or so asked organizations to write some brief but impactful statements about their organizations. We have not always been able to get them published the way we want, but we're going to start using our own self-publishing through our constant contact and others to get the word out. Well, that's really important. I think that's one of the things we want to do. And also really take a look, V and I and Fania and others really take a look at our social media and trying to beefing up our impact on that and getting more conversation, getting back and forth rather than just kind of statically posting information. I see Vanessa nodding her head, and you're a master communicator there, Vanessa. So we're going to pull you in on that too, because you're working with the Southside Task Force as well as the ROSC all over the state. So we just really want to encourage that. One of the newspapers we put this in, it's one of our partners, is the Austin and Garfield Lawndale Voice. They're asking for brief, like 150 words. Yeah, let's go for the pages. 150 word articles, but we want to get them in there. And if any other ideas you might have about how we communicate this to each other and to the community at large. And one of the things a special project that I hope to get off the ground in the next few months is getting some of our journalists that have been covering our work over the last couple of years together and really have a session where we can broadcast and talk about journalism's role and responsibility in covering the opioid and other drug epidemic. They don't always do such a great job, leaning towards the kind of sensationalism that smacks of the war on drugs. So we really want to make sure that we want to start getting our journalists, which many of them that have been working with us really do get it. But we want to get the word out and really to be able to cover the West Side from a strength perspective rather than a deficit perspective. Because look at this, we have this amazing group here of really talented, eager, dedicated people. It turns that whole idea of what people have about the West Side on its ear. And so we really want to keep doing this, get that out. And We Care to agency wanted to get my information. Yeah, I put that in the chat as well. Thank you.
All right, thank you. So I know we send out a lot of constant contacts, but it's better to over communicate than not to communicate at all, right? Praise the Lord. All right, we're gonna move on to our next piece. Lou, do we have anybody from our street outreach to give?
Yes, we do. Bring your greetings from the street team. We're going to do it real quick. We're going to do 3 of the outreach team members are going to give you a little update on what they're doing. We're going to start off with LaShonda. Are you ready? All right. Come on right in here.
Good afternoon, everyone. Along with the passing out of distribution of Narcan, we are now skilled assessors, myself, Gail, and Brianna. And we went out earlier this month and actually input some people into the system for all Chicago housing. We will now be doing this on a regular basis. We will attempt follow-ups with the assessed individuals on a monthly basis. And if you meet anyone who was unhoused, you can tell them to go to Pacific Garden Mission if they need immediate shelter. Yeah. So that's for the housing now. We're now housing, doing assessments for people who need housing.
Okay, Gail, are you there?
Yes, Lou, I'm here.
Right, your turn.
Hi, we just want to let people know that we still do group trainings. We did several group trainings last month. And all you guys have to do is contact Mr. Sias with the number of people, the time, and the date, and the contact person. We still come out and do group trainings. We do trainings at churches, recovery homes, senior citizen buildings. So if you guys would like to be trained, have the training as well, please contact Mr. Sias. Thank you.
Hey, Gail, we're going to put your number on there so they can reach you. Okay?
Okay, Mr. Sias.
All right, we're going to wrap it up with Melanie.
Hello, everyone. I'm sorry my computer screen is not working. So I just wanted to reiterate on what Gail said about the trainings and how important they are. Last week I attended the CSAC meeting, West Side meeting. It's a monthly meeting. It's organized by Maria Moon, and the organization focuses on a reentry program. And so they have different speakers to come and talk about the trials and tribulations of reentry. So I was there and I spoke about Narcan and how important it is for us to get it out on the street to as many people as possible. So as a result of that, they would like for us to come back next month and do an actual training in their meeting. So that was very good. Yeah.
That's a little update. And again, please reach out to us if you have any information about training or any hot spots. Just let us know. My number should be on any information. It's in the chat. Reach out to me. We're ready to go. Thank you, Fania.
Thank you. Thank you, Street Outreach team. Really appreciate it. Now we have Sheila and Tom to give us an update regarding Narcan and the CTA.
And my co-chair, Tom Nichols, who I see in the chat. So yeah, lots of good things to report. And I've got to say, this whole meeting has just been one great shot in the arm in terms of happy news, because it's great to see so many people involved in such wonderful information and so many heroes here, like the dynamic duo over there at Cook County Health, because they have been really, really instrumental, along with John at Chicago Recovery Alliance, in getting our work with the CTA. I say just keeping it moving along. So where we're at is the subcommittee presented a proposal to the CTA back in December, asking to get Narcan distribution stations or boxes on platforms at 9 sites. And we met in January with staff from the CTA, Denise Barretto, most notably, and she said that they were moving along. She said it was going to be just 4 stops, but now we're hearing maybe 7 to 9. So the number's moving, but the overall direction is exactly where we want to go, that we are leveraging resources that are in the community. Cook County Health is purchasing machines. Chicago Recovery Alliance will help hopefully with restocking. This is all, of course, dependent on interagency agreements, contracts, etc. But what's really remarkable is the openness that we're seeing. So far, fingers crossed, we have a good feeling about the way it's moving. Anything further, Fania, Tom, you want to say? Our subcommittee meets next week with the people from CTA included, Nancy Ellen Zussman, who is head of many things, including security and facilities, as well as our full subcommittee. So any questions from the group or additional points?
I just wanted to add in that it is because of like the coalition and bringing organizations together that can provide different services, have different connections, that has made this, progress start to go forward. So, understand that coming together has like just a ton of benefits. And when you see people with mutual interests, definitely connect with them. It's really helped us. And I can't thank, like Cook County, like CRA, people that just reach out just literally to help. So thank you all for that. And Sheila and Fania, thank you for covering for me for a little bit. Thank you.
It said teamwork makes the dream work. Corny, but true. I have one last ask, if I may, because I'm going to have to hop off too. But if anyone on this call, if you know of any family members who have been impacted by a loss of a family member to opioid overdose, if you would please, if they're willing to share their story, ask them to get in touch with me. I'll put my email back in the chat here. The reason I'm asking is that in order to spread, I work downtown, and of course now the ambulance goes by. In order to get the word out about opioid overdose and the communities it's really impacting, we want to tell compelling stories. And we've seen how the media has really responded to that recently. I've been tapped a number of times to share my story of losing my son to an opioid overdose on the CTA. And I'm glad to share my story, but I represent just one small corner of the community that's been impacted. So we'd really like to get a broader group of voices. So if anyone on this call knows of someone or groups, please reach out to me or ask someone to reach out to me. But I'd like to gather a group of people who would be willing to share their stories and also perhaps support each other in whatever way we can.
Thank you, Sheila. I appreciate that.
Thank you. Thanks, everybody.
Yeah.
See you next month. And thanks again for all you're doing.
Yeah.
Don't forget to put your information in the chat.
Well, I'm finished. Before I head out, I'm going to put my email and also my phone number.
All right. We have our housing group to give a quick report.
Okay.
Hey,
I'm
Mary.
Mary Dowling. Hi, how are you? This is going to be very quick. The Tim, who normally does this report, is on the road traveling, so I believe he's on the phone too. And he and Margarita Gonzalez from A Safe Haven, who co-chair the housing group, have nothing to report, no updates to report. However, Tim wants to remind you that on Monday, this coming Monday, the 26th of February, there's going to be a meeting of the work group, the housing work group, and we'd love to see you there. And I have Tim's email is in the chat, and I just looked back to see it is there. You have to go scroll down a ways. And we're going to have a presentation by on the recovery residence map. It's an interactive map being developed, and it's for public usage. And we're going to have a presentation on it, how to use it effectively by the Advocates for Human Potential team will be there. So we thank you. That's it.
Thank you, Mary, for that report. I so sweetly put Taylor on this agenda, and I didn't really get Taylor's permission. However, I'm hoping Taylor can present to us about the new emerging drug that CRA has found. So Taylor, are you still on the call? No, he's gone.
Yeah, he did. He left the PDF of a report
So
in the chat, and we'll share that.
yeah, so look for that. There is something besides xylazine in the drug system, and I cannot say the name, so that I'm gonna stay away from that. Does anybody want to share anything that they know? That's good. So we are down to member announcements. Yes, yes, yes. So raise your hand and let's call on you if you have an announcement of something happening coming up that you want to share with the task force. Vana.
Trying to unmute. Hello, everybody. How you guys doing? It's good to be on here. I didn't think I was going to be able to make it, but I was. So I'm going to try to be quick with this. So most of you probably know, as you work in the field, that the ASAM criteria has come out with the 4th edition. But what's super exciting for me and for those in the recovery residence community is that they have added recovery residences to the ASAM criteria. It is official. That's huge, right? So we were on a meeting February 1st with Dr. Beth Sanders, and Beth Sanders is one of the founders of NAR, the National Alliance of Recovery Residences, and Paul Early, who is on the board of directors at ASAM, and they have been working on this like literally decades to make this happen. So unofficially, when doing treatment planning for people who are in treatment for SUD, it doesn't really happen because it wasn't part of the criteria, right? Part of ASAM, but now it is. And so I've dropped a link to the updates and a picture showing recovery residents as part of the continuum of care. And it means a lot of things. It's significant because, like I said, it could be part of the treatment planning now. And then it could eventually be Medicaid reimbursable, which it is not. Recovery support services are not Medicaid reimbursable in the recovery home environment. So this could change. It may take a little while to get there, but we're well on our way. So this is super exciting. And I just shared the link and the image in the chat. So yay.
Thank you, Vana. That's wonderful news. Very good. Awesome. We have Ann from Thresholds. And if you guys didn't watch Monday's Chicago Tonight, Thresholds as well as Haymarket were featured with their homeless services. I thought it was really cool. So check that out. And I think we'll send the link out to that. That was amazing. So, Ann, what's happening?
Well, Thresholds is moving. Substance use treatment program is going to be moving into the Austin neighborhood, 115 North Parkside. We're moving, the party's starting there. We're going to be moving in on Friday. It will be housing our outpatient services, both outpatient and intensive outpatient, along with our recovery support team. And our we'll be sharing the space with the homeless outreach team for the West Side, and our team leader for the narcotics arrest diversion program will also be located at this office. So that's exciting news.
That is exciting. You're my neighbor, so thank you for
Good.
Yes, all right. Anybody else? Announcements? Anything coming up?
Fanya, just a reminder, there are several position openings in the chat for Oak Park coordinator for their developing task force. For the Illinois Harm Reduction and Recovery Coalition is needing a coordinator. And in addition, Rush's Substance Use Disorder Center of Excellence is currently hiring for a Latino services program coordinator. So lots of opportunities. It's great to see that we're seeing the need and making good headway in trying to address it.
Yes.
Dr. Sorrell, thank you for sharing that. Is there anything that you can share with Lee, Fania, and I that we can get these announcements out on your behalf?
There are flyers for each of those postings, I
In the
believe,
chat.
that are in the chat.
Excellent. We'll pull that and
As
share
well
with
as
our team.
links. Yes.
Awesome. Thank you, Dr. Sorrell. Good to see you.
You guys too.
All right, thank you. Any other member announcements?
You know, I just want to mention, this is Lee, that you all set a record today. There was 84 people when we started, and I think we had some shifting. So I bet you we almost had close to 100 people today. And we have a 100-person. We have a 100-person limit. We have a 100-person limit on our Zoom. We're gonna have to put out some more money for the future meetings.
104. Congratulations. That's a big deal.
Yes. Does anybody have any comments, questions? Because we have was about 7 minutes left in the meeting. So I want to thank you all for showing up today. Some really critical issues, but together, and that's what I feel. I feel a new energy. Together, we are going to address these issues on the west side of Chicago. I loved John Wright. John Wright said he wanted to turn our area is called Heroin Highway, its nickname. He wanted to turn our side of town to pathways to recovery, and that is what we're trying to do. Vanessa, do you want to reiterate about the rally that's coming up? And is there anything that you guys need help with when it comes to that? Oh, Vanessa, we can't hear you.
My computer froze up for a second. Hi, everybody. Two Ross councils here in the state of Illinois, Northern Illinois Recovery Community Organization up in Lake County, and the West Side Ross Council here, CRCC. We were nominated to be able to host for the very first time in the state of Illinois, the National Recovery Rally. This has happened all over the US. It's never happened in the state of Illinois. This is going to take the entire state coming together to actually put on the National Recovery Rally. We're so excited to have this happen. I don't know if I can share, V, if you want to help me, so I can share my screen. We have a save the date, and we're locking in actually the location as we speak right now. But it is actually going to be, and I'm going to share my
Tanya,
screen.
does she just need to be invited in as a co-host or a host? Oh, look at you.
Yes, ma'am.
There you go.
Yep, I got
You don't
it.
need help, Vanessa. You got this.
So everybody,
We
this
see
is the save the date. So please save the date. We're looking at Saturday, September 21st, 2024. We're going to turn the Heroin Highway into the recovery pathway. And this is actually with Faces and Voices. So this rally has been going on for, I think, over a decade now. It's been all over the US. It's a part of Faces and Voices of Recovery. This is national. So this is a way to put Illinois on the map and show the rest of the nation how we do recovery here in Illinois. If you go on the Northern Illinois, so it's Norco, Lake County, the Northern Illinois Recovery Community Organization, if you go on their website, we're asking for volunteers. So we need people from all levels, all sectors coming together, because it is going to be a full day of everything you can think of as far as what we're going to have going on. So more information to come as soon as we get the location locked in, then we're going to be sending out that communication. But this is exciting. This is huge. This is huge for the state of Illinois. This is huge for Chicago and us being able to host it here. So we're going to be asking everybody for help. Everybody's going to be a part of this to make this happen.
Vanessa, this is great information. Great thing. Thank you for sharing it. And please, everyone, make sure you tune in with Vanessa and updates on this. But the task force will send out details via the listserv.
Absolutely.
I'm in charge.
And the task force. So you guys, Fania, we've been talking to you for a while now. And task force is going to be a big part of this, getting, things set up here on the west side, because we may be doing some other side stuff too to try to bring, some more visibility to the west side. So definitely you're going to hear a lot more from us. And we
I'm in
can't wait
charge
to
of
be
the
working.
dancing and the DJ.
There
Yeah.
we go.
Yay. All right. I am going to let you guys go a few minutes early so you can go out and enjoy this beautiful day. Our next meeting is March the 20th via Zoom. And then we're going to try to meet in person in April, because we know it's going to be sunshine in April, so we can go and have some fun. All right. You guys have a wonderful day. Thank you for
Hey,
joining us.
Fania, can you make sure you save the chat on your computer since I'm on my cell phone?
I'm sorry, say it again.
Want to make sure you save the meeting chat on your laptop since I'm on my cell phone.
I will do that, V. Thank you, guys. All right.
Thank you all.
Bye.
Great
Thank
meeting.
you.
Bye.
Thank you.
See you guys.
Have a good day.
Sure, everybody.
Everybody.
See you, Lee.
Thank you, Vanessa, for getting that message out. That's awesome.
Absolutely. And
Yeah.
it's fantabulous to be on today. I'm just making sure I downloaded everything. Such good information. Thank you.
Yes, we'll be sending it out to you guys.
Awesome.
All right.